there's no question, but it poses a lot of challenges. I mean, if you think about it, we have an influx and we'll speak to the US, but really it's a global thing. The patient population is aging overall. Lifespan of patients are increasing, which is a wonderful thing, but they're not increasing without challenges and health challenges. And then you have this other population that's getting more involved with their own health and continuum of care and education, if you will. So as we think about all of these different things that are out there in general between these, the challenge that runs into then is data. And there's not a challenge with data in and of itself or getting data. There's a challenge that we see in healthcare today with how do you manage this data? How do you make it actionable? Who's going to look at it? Because at the end of the day, also, there's not an overflow of nurses in this country. Or even across the globe, right? We saw that through COVID and the pandemic. This really put a strain on our healthcare system overall. So you have this perfect storm of more data than ever, more people focusing on this space. But I think one of the big challenges and one of the things that I'd love to talk to you about is how we're working through this is how do you take that data and fit it into the environment or the ecosystem of the physician or the hospital system. Playing in the cardiology space for Baxter is not new. We've been in this space for many, many years. The addition of Barty Diagnostics was a huge acquisition for us, but one other key one that we made in November of 2021 was the acquisition of Epiphany Healthcare. And the reason why that was so important for us is not necessarily because of the size of the business, or it's not necessarily about, people make acquisitions to grow, revenue and increase profitability and all those things. Those are important. Of course they are. But for this one, what was really important for us is if you look at the healthcare systems today, what you've seen dating back 10, 15 years, or really since the inception of electronic medical records, we saw a lot of consolidation in healthcare. We've seen big systems merging with big systems. Normally it was kind of in their own geographies. Now it's in the US, it's across the country. It doesn't matter, right? Big systems organizing with others. We see big clinics and specialty offices being acquired by private equity firms and alike. And what happens there is, it's very hard to then drive standardization, if you will, to have people on consistent systems. So what the acquisition of Epiphany enabled us to do, Epiphany is really a leading provider in what I would consider vendor neutral. We don't necessarily care the devices that are in a health system today. So we could take a health system that might have, 20 or 30 different vendors, 50 different vendors that they're trying to consolidate information. Epiphany gives us the opportunity with our cardio server solution to take all of that information, to aggregate it via the cloud, which is really important. But it's a leading provider in cloud-hosted ECG management solution is what we call it. We decrease the burden from an IT footprint perspective. And being through the cloud now, we have the opportunity to take all of these disparate vendors and solutions and data and aggregate them, not just from a hospital perspective, but also from a clinic perspective, where historically that's been a big challenge. Clinics have never necessarily been able to share the information as cleanly and articulately as what's going on inside the hospital. So we're trying to meet customers with where they're at as they continue to grow, as they continue to expand, providing solutions that say, obviously, do we have an interest in organizing around our devices being used and making the biggest impact in healthcare we can? Of course we do. But it's also important for us to provide solutions and software-based capabilities that meet customers where they are and saying, listen, we understand you have multiple vendors. We understand you have multiple footprints across the United States. We could take all of this, though, and really fit this into the way that you're doing business today and really try to make a positive impact there.